and so is going to be leading us in a presentation and some discussion around issues of advocating for healthcare needs, specifically as LGBT communities, as people who are aging. So I will bring up Dr. Collins, and please welcome Dr. Collins.
Good to see all of you again. Most of you are familiar faces, but I see some new faces in the crowd, so good to see all of you. I want to start off by saying I'm going to be talking about advocating for your care, but I do want to disclose that I have a bit of a conflict of interest because I'm a doctor, and often I think people feel like they can't advocate for themselves when they're with a doctor. So I want you to speak as frankly as you can, because part of the joy of being in the healthcare profession is all of us, in addition to taking care of patients, become patients at some point ourselves. So I can relate to both sides of that, and caring for a sick parent, caring for a sick loved one as well. So keep that in mind. But I really want to hear kind of from you, from sort of the patient perspective as well, okay? So to start things off, what are some of the biggest problems you find and you face getting health care? Yeah.
When the doctor's not listening, then you just have to start hollering. Forcefully, which is irritating to you.
Absolutely.
Because it's like, I'm telling you what's going on, what's wrong, and then you want to tell me that's not what's happening.
Right.
When this is my body.
Right.
I'm not being the doctor, but I'm telling you what's going wrong inside and outside.
Yeah. So doctors not listening and not being able to hear what you're saying. Yeah. Yeah, go ahead, sir.
Insurance companies now.
Oh.
As far as like you prescribe a certain
Thanks
kind
for
of
that.
medicine,
Yeah.
and the insurance company will not pay for that particular kind of medicine.
Yep.
And you got to get a lower dose or generic.
Getting
Yeah.
the generic, you mean?
Which don't work at all.
Yeah. Well,
Okay. Yeah, go ahead.
Not doing your proper homework as a patient.
Sure.
Walking in and thinking, doctor, I know you only have 10 minutes with me. This is what I want to discuss. My nose, my ears, my throat, this rash, this. Right. You got to do that first because they have limited time.
Yeah, that's the truth, unfortunately, about healthcare. And one thing most of us in healthcare hate, we went into medicine to spend time with patients, and I think often we're limited to a very short amount of time in the interest of keeping the lights on, I think. Yeah.
All the bureaucracy and obstacles.
Yes.
One after another.
Yes.
Which, of course, you find on your side, too.
Sure. No, nothing is quite as bureaucratic and complicated and as much of a mess as the American healthcare system. I think we all can agree with that. Yeah.
Getting relevant information from the doctor.
Sure.
And I went to a support group and someone suggested making a list of your questions.
Yeah.
And I tried that and it worked. The doctor was very receptive and let me ask my questions and he answered them.
Good. I'm glad you were able to find somebody who listened to you. And we'll have a couple of tips coming up about sort of how best to advocate for yourself in that sort of 10-minute visit that you have with a doctor. Yeah, go ahead.
I found a lack of communication among doctors.
Yes.
My grandmother was allergic to a dye that they usually use, and I thought if they write it down in the chart, so every time a new doctor comes in, they're going to give it and I'm like, wait, don't y'all read the chart? So I think it's a little bit better, but I think the lack of either they don't read the thing or they don't talk to each other,
Yeah.
so everybody, and it was just frustrating. They had to keep going through the same thing.
Absolutely. Yeah.
in the summer, I needed to see, I guess it was 2 specialists. And my primary doctor's office gives me a list of, here are the doctors that take your insurance. So I went home and I called this one. Oh, I never, where I went a year ago or something like that. Oh, this office no longer sees people in Medicaid.
Okay.
This office never sees anybody. So instead of seeing somewhere that was in the Northwest where I live, I did see someone good, decent, at your hospital, which worked fine.
Good.
Only needed to see that person once, so that was okay. But it's just after you make all these phone calls, because it's just the bureaucracy stuff.
Yeah. Right.
I used to see you, but now I can't see you anymore. And it was the same with the rheumatologist. My doc said I hadn't seen a rheumatologist for a while. Yeah, so I had a page and a half of names that were covered by my insurance. And then there was one that I saw years ago, and we had one of these hospitals that's no longer open anymore. So I thought, well, let me call that office. Office up the Northeast, and then they said, oh, we also have an office on the City Line Avenue. I said, oh, that's not far from me. I'll
Yeah.
go there.
Yeah.
So that worked. That worked
Good.
out, except it's a
But
copay is a little too high for me, but at least it's
yeah.
I like him.
And it's also not like you're finding an auto mechanic or something like that. You're at your sickest, kind of most vulnerable point and need somebody you really can trust. I would argue you also need an auto mechanic you can trust, right? But you know, you're at your sickest and sort of most vulnerable, and we don't make it easy for people to find help. Yeah.
Which is probably why you should do it when you're not sick.
Absolutely, absolutely. And a lot of this is going to be about kind of preparing and how you can advocate for yourself when you're feeling well.
Right.
Yeah.
The bad thing about getting older is that when you're a senior citizen and trying to get a point across, and the doctor is trying to be receptive, he's not being receptive, and then you have to say, well, why is this happening, or why is it starting to happen now, and it hadn't happened 5 years ago?
Yeah.
And you're back at the same old predicament you started when you first started out.
Mm-hmm. So doctors kind of not knowing you well, not listening, not kind of communicating with each other very well. Can I ask, what are some obstacles you find when you disclose your sexual orientation or your gender identity to docs? If you do.
Homophobic positions are out there.
Absolutely. Yeah. Homophobia. Yeah.
Well, my experience is good with that.
Good. Good. I'm glad to hear that, for sure. Would anybody care to kind of share an experience they had with a healthcare provider?
I get most of my care through the VA because I'm a vet, but I also have outside because the VA wants you to have other avenues of treatment.
Right.
And I find that, for me, this is just for me speaking, being a vet and transgender also has not really been a problem with the VA because they sort of come up to the 20th century.
Yeah.
Because
After
there
a
are
long-
veterans who are, you know what I'm saying?
Yeah, absolutely.
Despite what you hear now, well, anyway, that's what I'm saying.
Right. I know what you mean.
But sometimes now, when I use my other insurance for out here, because what the VA, the people think because you're a vet, you get all your care from the VA. The VA don't cover everything.
Yeah.
So when I need a certain procedure done, they will allow me to contact an outside hospital that they are familiar with or associated with.
Good. Right.
And have whatever is done through them. But I've never ran into any type of problem. I mean, personally, for me, I'm sure I have heard some have. I never have. Maybe I'm just too damn big to argue with something. I never.
Well, I'm glad. I'm glad. Whatever the reason, I'm glad.
But I've never had that problem in getting it. The only problem I have is that, you see, like one doctor will override what the other doctor says, because now he thinks this is better for me. Even though the doctor that told me to go to you because of what they don't do, and they seem to clash. It's like, well, I said you should get this done, but then this doctor says, well, I don't think you need to do that. You need to do it this way. So that is what I've been going through.
Yeah, and I think that's a big
third thing
yeah.
when it's clashing like that.
Right.
Yeah.
And I think that's tough because I think a lot of people think that in medicine there have been extensive studies done about something, and in the reality of it, most of medical practice is sort of art. So sort of one person's opinion over another person's opinion, and there aren't definite rules about.
And I'm going to ask you this question. I just turned 64 yesterday.
Oh,
Now,
happy birthday!
The basket's coming around for gifts.
And her friend had a birthday last week.
I did healthcare from 2 different places. But I'm approaching that age where, is Medicare, should I be looking at that? Even though, I hate to say it this way, healthcare as far as I'm a vet is going to be. That's going to happen. It's unfortunate for those that don't have healthcare, that they can't get it as fast as I can or will have. So do I look into Medicare as well? In
Yeah.
addition to what I already have?
Yes, yeah. So you'll be later this year. You'll be getting something in the
Right.
mail from
Request a
Medicare.
65.
Level.
Another year.
Will precede your 65th birthday.
Join the
So
club.
Next birthday.
yeah, and you can go through kind of what your
Oh, so they
options are.
automatically contact
Yeah.
you when you get, ain't that some shit?
I know, right? Yeah.
There you go.
Yeah, go ahead.
It's good, yeah.
Patients need to be
No.
a little more forthright at times about challenging their patients who think they know more than the doctor. Case in point, had a cold. My uncle said, go see Dr. DeSimone or whatever, and ask for antibiotics. No, I need to be told by a physician. An antibiotic is not going to work for you. It's
Right.
going to make things worse for everybody else.
Right.
And, you know, I think a problem is all this drug advertising on TV. People hear about, oh, get this for your eyes, get this for your liver. And people go in and say, oh, I have a liver
Order
problem.
it up.
I want
Yeah.
this, give it to
Yeah.
me. And the doctor might say, well, no, it's not really appropriate. But I want it, it's advertised. And if you don't give it to them, they will dump you and go to a physician who will.
Right.
Does.
Right.
That needs to be worked on.
That's a struggle we have every day.
Right.
I can tell you. Yeah.
I'm retired from Verizon. We had health insurance, which switched over to another one when I retired. However, there's a list of doctors that you are supposed to use, but they never state next at the end of their statement, oh, I treat gay patients.
Yes.
So you don't really ever know.
Right.
You have to hunt down who's a gay-friendly
Right.
doctor.
Right.
I was lucky because I found one outside of the program and they will cover it.
Good.
But in the charts, nobody says, oh, I'm gay too.
Yep. Yeah. So I do want to talk a little bit. That's a good lead-in for kind of the more.
You had
talks.
asked
So yeah.
About coming out to doc.
Yeah.
In my primary care doctor's office, there used to be 7 doctors, now there's 4. And some of us in the neighborhood happen to know that one of the partners is lesbian. And many moons ago, I watched her children when they were this big, and now they're
Aw.
out of college. But
Yeah.
but they are
It's good to
comfortable.
know. Yeah.
You can be fine with that
Right.
office anyway.
Right,
Yeah.
right. So I want to kind of start with what we all know, the bad news, okay? In a way to sort of transition into the good news, okay?
Get this asshole for
So
president.
we know that LGBT people have healthcare disparities, so they're not in a lot of ways. So for example, lesbians receive Pap tests for cervical cancer screening and mammograms less often, tend to have higher rates of smoking, alcohol use, and obesity. Gay men, as we all know, have higher rates of HIV and AIDS, smoking, alcohol use, and cancer. Transgender adults tend to get mammograms, Pap tests, and prostate screening for obvious reasons less often than cis adults. And discrimination against LGBT individuals can lead to a whole host of psychiatric issues. And then kind of as LGBT elders grow older, we know that 33% of them, which is higher than the average, tend to report depression. About 50% report loneliness. Half of them live alone compared to about a third of heterosexual older adults. They're half as likely to have a significant other and about 4 times less likely to have children who potentially could serve as a caregiver. So this is taken from a 2011 study. Hopefully things have gotten better, but we know that about a third of LGBT identifying people say that they have delayed or avoided health care in the past, whereas only about 17% of heterosexual adults say that. So that is significantly different enough to say that there is something we as healthcare providers aren't doing to provide access to our LGBT patients. So the good news is that LGBT older adults have been through it, as all of you know. You're a resilient group. You've faced many, many unique challenges and had to advocate for yourself in the face of tremendous adversity.
Hey.
And that's right. And have had to create families of choice, often when traditional caregivers don't exist. So I do want to tell you that there is tremendous hope in this group and tremendous resilience. So how do you find an LGBT-friendly provider? And this is something that, as doctors, we kind of assume that everybody will just come to us, that we don't have to advertise our welcoming or our welcoming kind of attitude toward people. And I think another thing that kind of comes up is that often, even if we're welcoming providers, there's a whole host of bureaucracy and staff and other people who you interact with that may not be as welcoming. So that's kind of a challenge as well. I saw a hand go up, so go ahead.
Oh, first, right, when I was diagnosed with HIV, right, and plus I'm bisexual, and I'm like this, right? Listen, absolutely, I'm not, hey, okay, now you ain't smiling. Listen, anyway, right, I was saying this, is that when I first was told to go to Philadelphia fight, I had no knowledge of what was, the clinic or whatever. Okay, and this is the fact that when I went and seen other people first say, oh, you gotta go to that clinic right there, but not knowing that it's a lot of gay people that goes there also too. Okay, I mean, I still didn't find myself, what's that word I'm looking for, offended, or that I stopped going because of that. This is the fact that the people that provide treatment, they're just regular people, you know what I mean, okay, and they have a life of how they live, you know what I mean, and mostly the doctors I have, like, I can go way back, Sarah, all of them, they're good people. I don't look at it as far as, like, I'm judging, I'm just there to just take care of my problem, and they are willing to help. So I'm just saying, is just that my whole thing is that also trying to find a clinic.
Yeah, so
okay,
I
like
think
you got
that's
Mazzoni.
right.
Mazzoni is like, you know what I mean? And like I'll go with Mazzoni and I'll sit and I just watch the different people. I don't judge them or nothing like that. It's just that, it is what it is.
And I think that's a little tricky. I think traditionally we've we've kind of found LGBT-friendly providers through HIV/AIDS clinics, like Philadelphia Fight, like Mazzoni started that way anyway. But I think, as we get older and find ourselves with many different other comorbidities, other conditions, it's more difficult to kind of navigate how to find specialists, how to find primary care docs. Yeah, sir.
I think we patients need to be a little more forthright about ourselves when we choose a physician. Now, I know this is hard to do, but we need to go in and say, hello, doctor, I'm considering you for being my physician. I think I may be gay or bisexual or whatever, and I engage in these sexual practices. Do you have a problem with this? You'll be able to tell in 10 seconds.
I bet you will. Yes, yeah. And I want to tell you that at least in the primary care world, very little shocks us. So I do want to encourage you to be forthcoming, okay, with your patients. And again, you will be able to tell within 10 minutes or 10 seconds of whether or not you found the right provider.
The body language.
Yes. So here are a couple ways that I found that are recommended for finding an LGBT-friendly provider. First of all, ask your friends who they know. This is the best way. This is how many people find good health care. Ask who they feel comfortable with, who they found to care for them. And then, of course, the LGBT Elder Initiative or Philadelphia Corporation for Aging. We have resources on the back table here. Another thing is to cold call clinics. This, again, takes a lot of guts. But say, does your clinic provide care regularly to LGBT patients? Again, you'll know if they say, "Oh, we welcome everybody," or ask them, "Do you have patients who or doctors who feel comfortable caring for them.
Yeah.
Yeah.
But also too, from you saying what you're saying, also some clinics are just about business. They
Most
don't care
clinics.
about.
Yeah. Yep.
No,
Yeah.
You made me think about that.
Yeah.
It's true.
Yeah. Well, at least, yeah. I'd say most of primary care docs are not just about business, but I would say most clinic administrators, that's what their job is, to keep the clinic in order or in gear. So they will definitely tell you that they take anyone. But I think
some doctors they may have too much on their plate. They
Right.
can't put you on their caseload.
yeah.
So they put you on somewhere else. They give you to somebody else.
Yeah, that's
but
it.
The doctor that you used to have that had too much on his caseload, you know him or her that
Yeah.
she's gonna take care of business.
Yeah.
But then you got a question mark in your mind like, oh man, you can send me to this one. But
Yeah.
how is she or how is he?
Yeah, yeah. And I think that's important. If you find a doctor who you like, sometimes they can be the doctors who are harder to get in with.
Mhm.
So scheduling appointments in advance, if you go see them, schedule your next appointment, even if you don't think you'll need to see them, schedule it get on their calendar so you're one of their regular patients. Because if you call the day before you want to go in, it's often difficult to get in with doctors who are popular, and usually they're popular for a reason, because they're good. Yeah.
Yeah, I also, two things. One, I think Philadelphia has, I'm a very big proponent of the Mary Howard Clinic.
Mm-hmm.
And you ask people, I mean, again, it's been proven, but the
Which
care,
clinic
the
did you say?
compassionate care. And then you ask them for
Yeah.
referrals, because
Mhm.
you can kind of trust them. They
Yeah.
take care of everybody. And as well as the Mazzoni Clinic, and despite all the problems that's happening, it's still. But also when you go to like emergency rooms or other, keep a diary of how you're treated
Yeah.
yourself.
Yes.
Always, and okay, if something doesn't click right, you write that down, you keep it for your notes and that kind of thing. But I think it's the way of again, advocating for yourself,
Yeah.
but keep a diary of that kind of thing.
Yeah.
And get referrals from people that you trust. Also use PGN. I mean, PGN, they should have a health, they should have health, I think they have health information.
Or
And
if
again,
advertisers in PGN,
right, yeah,
you
So
know.
if it in the
pay attention to
front.
that particularly,
Yeah.
and if they don't, then, you know, call them up and
Sure.
and tell them what to go. But they're our voice, or they're one of the voices we have. Make them work for us. That's the other kind of thing.
Absolutely, yeah. And the good thing about one of the benefits of healthcare being a business is that they work to serve their customers. So if you are a squeaky wheel in healthcare and you file a complaint, people listen most of the time. Yeah. So just a couple other things. I did want to point out this website, sageusa.org. It's from the organization SAGE, which advocates for LGBT older adults. They have a list of mostly it's facilities, home health care services, nursing homes, who have been trained specifically by their group to provide quality care for LGBT older adults. There are several places in our area. So if you're looking for a home health aid organization or things like that, definitely look into that. Check for non-discrimination policies on a facility's website, and make sure that it has gender identity and sexual orientation listed as one of the things that they do not discriminate against. Okay, because that is not necessarily something that all hospitals have. Yeah.
I have a question.
Sure.
It's like everything that's LGBT friendly, from Mazzoni, okay, to the advocates, to the activists. Okay, but what about in those clinical settings of hospitals like Jefferson, Temple, or University of Pennsylvania? And I know University of Penn does a wonderful job with the LGBT community, but Temple does too also. But somebody questions Jefferson as a question mark, and I question it too. And I love Jefferson. But do they actually advocate? Are they allies of the LGBT community at large?
So I can't speak for Jefferson at large. I'm from I went to medical school and residency at Jefferson, so I like Jefferson very much. But and they have been involved in LGBT. I know they have been supporters of the LGBT Elder Initiative. Having said that, I think we have a long way to go.
Gotcha.
One, I think, easy step would be making gender-neutral bathrooms in the hospital, things like that. I think we could go further, as most hospitals in the United States could.
I would
Yeah.
like to say in support of Jefferson, I've been HIV positive for about 15 years now, totally Jefferson, except for a study at Penn. I have never experienced the slightest bit of LGBT discrimination from anyone.
That's wonderful.
Ever. at
That's
Jefferson.
great. That's great.
Nor anywhere else in Philadelphia. I guess it exists. Maybe
Yeah.
if you're in Hot Coffee, Mississippi.
Yes,
It
yeah,
doesn't seem
there
to be
is
too
some.
much of a problem here
Right.
in Philadelphia.
Right,
I don't
right.
think.
Yeah.
And I salute Jefferson. I
Oh,
like
good. I do too, obviously.
But I like University of Penn too. They're good.
Yes, yeah. I think we're very lucky in Philadelphia.
Yeah.
Yeah.
In answer to your question, most of what I need to get done from outside the VA is done at Jefferson.
Okay.
And for this important fact, I was born there 64 years ago.
Oh my goodness! Wow.
Old building.
Yeah.
Isn't that nice?
Sorry, Alice, you had a question?
First of all, I'd ask people to speak a little louder. I have some hearing loss.
Jefferson is good.
Okay.
And number two, this lady also had a birthday.
Oh my goodness!
We can clap
Well,
for her
happy
because her friend
birthday.
comes out of the room.
Oh yeah. You're too sad, you're
It's a
sad.
birthday club.
You had a birthday and your friend, right?
I had mine yesterday. Hers was last week.
Oh my goodness.
I hope it's
Happy
Saturday.
birthday.
All right.
Let's give her. Let's embarrass her.
Never mind the class. Give up money.
Right.
Yeah, it's fine.
Okay.
Yeah.
So now I want to move on. We touched a little bit on this, but how do you bring up sexual orientation and gender identity with your healthcare provider?
I just tell them I have to.
Good.
I don't know, you don't know, but
Perfect.
you know what? Look,
Yeah.
this is how it is. Blah, 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 blah.
Yeah. How would you advise someone who is a little bit more reticent? Or sorry, Frank, go ahead.
Same with me, I just tell them.
Perfect. Great. How would you advise somebody who is, in the closet, isn't comfortable disclosing? Yeah.
Want me to ask for you?
Good. Yeah. Yeah.
Somebody can advocate for them.
Yeah. Absolutely.
I personally think your healthcare is number one. And I think if you're gay or you're bisexual or whatever you are, or whatever you want to know, whatever, I think you need to go to a provider that's definitely cares for you.
Yeah.
Definitely loves you and shows you what you need to do instead of going through this fun house and you don't know where you're going.
Right.
And it's crazy. You need to know your healthcare is number one. And at the end of the day, you are the masterpiece of the artwork.
Right.
So remember that.
Yes.
You are the artwork.
And I think, as a primary care doc or somebody trained in primary care, my interest is in taking care of the whole person, or it should be, right? And part of that is your sex life and your gender identity. It's not that I'm asking because I want to rank you on some people who are right, people who are wrong, group. I want to know what puts you at risk, for one thing, and also who you are as a person and how I can best take care of you. Yeah.
And sometimes also depends on the doctor, if it's a male or female.
Yeah.
How comfortable I am
Sure.
disclosing my identity to them.
Sure, absolutely. And that comes up a lot. I think as docs, we tend to see the people who are most like us, I think, a lot of the time, just because we feel comfortable around people who are similar to us. So I think, for better or worse.
Because like for instance, say for instance, you get ready to get one of them things right at the doctor and it's a male, right? And he has to stick his finger, just to check to see if you had a polyps or whatever, and then you're behind.
Yeah.
And I had a male doctor at one time, right? And I was trying to actually on being realistic, right? But he did also mention to me, he said, now listen, he said, I ain't got to do it. I can get a female to do it though, if it's up to you. Which one you prefer, me or her? You know what I mean? That's something.
And I think that's important too. Advocate for when you feel uncomfortable, say something, okay? And I think a lot of us sort of take for granted, because we do it all day, we take for granted how awkward certain things are that we do in primary care. What I think personally is that when you see a new provider, they should be asking you, and asking you without judgment. Unfortunately, especially as we see patients who are older, we sort of forget that older adults have sex lives. And that's a bias that comes from us. So if we don't ask you, please tell us, okay? Bring a friend who you trust to your visit. As the gentleman in the back was saying, have someone advocate for you. Have someone say, this is, if you're not comfortable disclosing things, ask permission to disclose for someone else, or ask, bring it up kind of when you feel most comfortable. This is something that we docs don't do a great job at. Another thing, when you're being examined, when you're having a pelvic exam or an examination of your sexual organs, of your genitals, that's not the time to talk about the most sensitive topics, okay? Even if your doctor brings it up, I think it's a time to be like, hold on a minute, I'm gonna put on some clothes and then we can talk, okay? That's a vulnerable place to be in. And then ask them specifically about what puts you at risk based on your sexual orientation or gender identity. And this is another thing that I think as docs we could do a better job of, but asking patients what pronouns they prefer, okay? And how they describe themselves and their partners. So if someone's not asking you and they're not using the correct pronouns or the correct terms for your partners or for you, let them know. That's not something that you should be shy about. Yeah, go ahead.
When like the trans community, I'm a piggyback on what you said. And some of the issues around the younger ones, and when they're out there street working or whatever, they're looking for somebody for care, but you're right, the disclosure issues and the stigma attached to it is harder for them, even at their age. Now, she's glorious because she's up in age, she's a veteran and everything, but the younger ones are struggling, trying to make it from not being homeless and living on the street. So the question is, how do we support them as an LGBT umbrella to kind of bring them? And I think thank goodness for the Win-Win Center, because they're really pushing the effort. But it has to be more of us to kind of engage ourselves in the process of helping these younger ones,
Absolutely.
getting them involved, and trying to help them out as best as we can,
Absolutely.
But it's a task. It's
It is. It's hard to. I think that's something we struggle with in primary care, is how to access individuals experiencing homelessness or sex workers. That's something, because they don't tend to come in for care for all the reasons you said. So that's something I think we need to work on as a healthcare system. But absolutely, if you've been through it, if you if you know people, reach out. Absolutely. So we kind of talked a little about this, but why come out to your provider? Because it gives you better care and it helps them take care of you as a person. What are your rights as a patient? So you have the right to be treated with respect and quality. You have the right not to be denied service or given inferior service. You have the right to be called by your chosen name and by your preferred pronouns. You have the right to say who makes medical decisions for you if you can't. And fortunately, with the passage of the Affordable Care Act, a lot of these, that's okay. A lot of these are now federal law.
At least currently.
Right, exactly. Yes.
We hope still.
So keep up the fight to make sure that doesn't change, right?
I think there's one that you didn't list there.
Yes.
As I understand it, a patient has a right, legal right, to receive get copies of all his medical records.
yes.
They cannot issue. Yes, they can say we're going to charge you $2 a page to give you a copy, but if
They
you
can make
want
it difficult, but if you want it,
if you want it, you have a legal right to it.
yes, yeah,
Including psychiatric records.
yes, yeah. You were right about that.
And when it comes
Or,
to
I'm not sure about psychiatric records, but I certainly for all other medical care. Yeah,
and when it comes to religion, you have a right to worship where you want to worship.
that's right.
Okay, whether you're trans or not, whether the pastor throws you out because you're coming in trans, it doesn't matter. You have a right to worship where you want to worship.
Yes, yeah.
But with the psychiatric, your doctor has to give they have to get a written consent to share your records.
Okay.
They can't just give it to you.
I think if you are interested in that, here's a little trick. If you're seeing a medical student, a resident, a junior doctor, they might be the person to ask about your medical records. Sometimes they can get them in ways that that are a little easier than the straightforward way.
My doctor gave me my medical records.
Good. That's oftentimes doctors are, if there's one particular thing you need to find, a doctor can just print it off for you. And it's easier than going through a medical records department. Yeah.
Can you have your records forwarded to a new doctor and they have to?
Yes, they do. Yeah, for sure.
And could I go back to a question from the previous screen?
Yeah.
Are there doctors who specifically treat sex workers?
There are. I think most of them work at places like Mazzoni, Philadelphia Fight. And there are a lot of people doing very good things kind of in among like at Project Home, at some other places that take care of individuals experiencing homelessness, a lot of whom are sex workers. So that's something to think about also. So what should you do if you find somebody who is not LGBT friendly? Sue them. There you go. It's the American way. So my advice would be, if you find somebody who is not, who you consider, and this is your definition, not LGBT friendly, find a new one. Fortunately, in Philadelphia, we have the benefit of having too many doctors to count. If you throw a stone in Philadelphia, you'll probably hit a doctor. Most other parts of the country are not like that, so take advantage of that. If you experience it from a staff member or from a doctor, tell the person in charge. So if you get it from a medical assistant or from staff or reception, tell the doctor. If you get it from the doctor, tell the administrator. You can also formally file a complaint with the Joint Commission and with the Department of Health and Human Services.
Lawyer gonna do that.
What's that? A lawyer?
Gonna do that.
They could do that for sure. And then the most important thing is tell your friends. You know, if you know, that's kind of how things sort of get around and how people change their practices.
Sure, a letter to TGN.
Yes.
Immediately put it on email, which has a record and a history, so they can't deny it. Because if you know, if everybody has a phone, put it on email if you've got that. But that it documented immediately as soon as you can.
Absolutely.
So that they can. So if they deny it, you have, you know, that's part of the thing.
Yeah.
Use the technology that and part of that advocacy.
Right. And make sure you let the patient services department of the hospital or the, if there is one, certainly let them know. Most hospitals have a patient services organization. Okay. So a couple other things to advocate for your care. Someone said bring an updated list of all of your medical problems, the medications, and make sure it's updated. That's very important. Some people bring in lists to me from 1993, and it's great to know what medicines you were on then, but it doesn't help me that much now. Write down what allergies you have and any surgeries you've had, and remember to bring that to your appointments. That can make things a lot more succinct for you. Ask questions when things don't make sense, and remember, as someone said before, write down a list of things that you want to ask. And keep in mind that most doctors only have about 10 or 15 minutes to see you, so try to keep that to your priority things. And if you don't feel like you get your questions answered, there's no law that says you can't schedule an appointment for a couple days down the line, okay, to get those answered. Yeah.
Another good thing, particularly if you're HIV positive, when you see the doctor every 6 months or whatever, try to get the lab work done like a month or so before you see him. Call the office and say, I have an appointment in December, this is November, I want lab.
Perfect.
Have the results be fresh,
Yeah.
not 6 months or a year old.
Yes, yeah, absolutely. So getting lab work done before you see the doctor so they can talk about it with you and make changes to your medications based on that if you need it. One thing I do want to plug, especially for older adults, is get an Advance Directive, okay? I wrote down a couple of things. Planyourlifespan.org and Prepare for Your Care. Those are 2 sites. Also, a document called 5 Wishes. We talked a bit about advanced care planning. The most important thing, we spoke about that at an earlier talk a few months ago, but the most important thing I want you to think about is identifying someone in your life that you can rely on to make your medical decisions, and write it down in documentation, because unfortunately for better or worse, the Pennsylvania appoints people based on family relations as your next of kin if you weren't able to make your own medical decisions. So if you were sick and in the hospital, it may go, if your parents are living, it may go to your parents, it may go to a spouse, it may go to adult children, and a lot of people don't want those people to make decisions for them. So remember to write it down. Yeah.
Another good thing is if you're HIV positive, go AIDS Law Project will do it for you.
Wonderful. Thank you for that. Yes. AIDS Law Project is someone who will do that for you. And talk to that person and tell them about what your wishes and values are for your care. And I think that's all we have. I think we're
for this part of it. For this part of it.
Oh yeah, sorry. Any other
We
thoughts?
can take a couple minutes though for
Okay.
questions if there are some.
Sure. Any thoughts, questions? Yeah. Go ahead. Yeah. Sorry.
Either day you have a friend, and the thing, and I'm glad a friend of mine did it. He was emphatic about it. He said, "Have you living? Had this made this up, had this done, this done." I kept putting off. He said, he grabbed me by the ear one day. He said, "We're going to do it today."
That sounds like a talk I've had with my parents. Yep.
Well, I'm still here. He passed away.
Oh, I'm so sorry.
He just moved to John C. Apartments. I helped him move it in and everything. He said, I'm going to have to put the time, this, that, that. And then it was like 3 days he didn't call me. I got worried. I said, I was not like him. And then I got a phone call. I called, and his sister was there. And I told his sister, I said, he passed up, didn't he? She almost dropped the phone. She said, how did you know? I said, I just did. Got a massive heart attack. And, but he was smart enough to put everything he had in order before he left. So that was a calling call for me. I said, I'm glad I did do it.
That's a real gift to the people who are left
If I got anything else to do next year, I said I'm gonna put somebody else on.
Get it done, right?
Yeah.
So before I was finally go.
Yeah.
Somebody said something, and I just want to be clear. Someone said something about generic drugs not working. Could you clear that up?
Sure. So, I am a big proponent of generic drugs. They're made out of the same molecular formula as the initial brand name drugs. Sometimes there can be issues with certain people and certain generic drugs because of things that they add to the drug, or certain dyes that they use to color the pill, or certain formulations, and that sometimes can cause allergic reactions or sort of idiosyncratic reactions to that medicine. But by law, they need to be, so if you're ordering low pressure brand name, it has to be the same as the generic metoprolol by law.
Why the insurance company won't pay?
So the reason they won't pay for brand names is because the generic is the same molecular structure, so the same drug, and it's much cheaper. Yeah, go ahead.
This is a difficult question, but I mean, this theme has come up a lot. If you feel your physician isn't listening to you, how do you approach that subject with the physician in a way that doesn't totally turn him or her off, and yet gets you?
Yeah. I think you have to say it directly. I think what a lot of people do is sort of shut down, and unfortunately that only does you a disservice. So I think saying something like, I'm not sure you understood what I was saying. This is what I was saying. This is what I was asking. And, a doctor's office, you certainly don't need to be confrontational. But on the other hand, it's a place to be direct, because it's a short amount of time that you need to get information from them, and they need to get information from you. But it is a place that I think directness is at home. That's what you should be doing.
Oh, here's the interesting thing. Mixed messages happened at Jefferson. Drug expiration. Well, I'm HIV positive, so I take drugs. You get them a month supply every month, but you can refill it after 25 days. So if you keep doing it every 25 days, you're going to have a two-year supply real quick. Well, anyway, I asked not Dr. X's assistant first. My HIV medications, it says expired like last year. It was over the should I take them? Oh, no, throw them away there. You shouldn't do that. Well, anyway, Dr. X came in later with the pharmacist, and I said, oh, you don't have to worry about that. To what extent do you really need to respect throw this drug out after 1 year?
So,
or it depends on the drug, I'm sure.
Right. So I'm not a pharmacist, but I can tell you kind of what I know is in general, antibiotics are a class of drugs that you have to take when they before they expire.
Right.
Most other medications, and certainly the pharmacist at your HIV provider would be able to answer this better than anyone. So I would take his or her word for it.
More than the physician.
In that case, I would. Yeah.
What about side effects? Because for someone, particularly with HIV drugs, and I've been for more than 30 years, I had doctors that say, well, there are no side effects, and that's immediately a cause for divorce, because that's absolutely not true. But I know a lot of those drugs, particularly early, for HIV, the side effects were more devastating than the drug, and you should always know what the side effects are.
Absolutely.
And the doctors should be willing to tell you.
At least the ones that happen to most people. Unfortunately, we don't know what a particular drug is going to do to you individually, but we know that when we've given it to thousands of people, this is what happened to a large majority of them. Go ahead.
If you have a problem with the generic drug, and if you call the pharmacist and tell them, do they have to change it to another generic? They can generally. You might need to go to another pharmacist or another pharmacy. You may need to call your doctor and have them change the prescription. But generally, they can change the generic. Sometimes I've had patients who have gotten generics from one kind of manufacturer of the generic drug and not done well, and done well on another manufacturer's brand. And again, that's sort of individual specifics about dyes and fillers that they use in a particular drug. No, they're not exactly the same. The drug itself, the thing that acts on your body, is the same. But the fillers, the dyes, the things like that is somewhat different.
Maybe take one more question for Dr. Collins.
Okay. But this is going back to the Advance Directive. This is my husband of 2.5 years.
That's wonderful.
And even if I was to get sick today to my wife, am I to rely on on his judgment as to what's best for me, or should I put it in writing? Even though he's my husband, and I'm pretty sure if something goes wrong with me, what have you, he has an idea. But should I put that in writing to make sure? Should I put that in writing to make sure that he do what I want done?
So,
or rely on him?
So I would definitely put it in writing, because that I'll tell you, as somebody who deals with people and families at the end of their life on a day-to-day basis, it takes a lot of stress off of your loved one to know that that's what this person wants. And I'm not the one who's taking the tube out. I'm not the one who's withdrawing nutrition or whatever the case should be. And also, God forbid something happens to your loved one. Yeah, if something were to happen to the one that you appointed as your decision maker, you know, it's helpful to have guidance.
Okay.
Yeah. All right, well, thank you all so much. I really appreciate all your participation.